Ocala.
All right, 5 minutes after 10 o'clock. Thank you for tuning in. We have learned a lot from Mark Shaw down at Dr. Juan Jordan's office in the Villages.
Oh, yeah.
Part of the reason we've learned a lot is because Mark tells us. Another part is because Joe and Patsy are actually getting treatments from Dr. Jordan. And among the other things that they do down there in the Villages, just kind of repeat that. Because I know as you listen, you hear us talking to different guests from all over the country, all over the world, really. But in this case, they have good information, and Mark is right here, right down the road in the Villages. Geriatric care, orthopedic care, weight loss, diabetes, and we've the one that gets us all excited is the platelet-rich plasma treatments.
Yes.
And we've learned that helps heal bone and ligaments, soft tissue. I'm not an expert, but that's all I need to know. I don't need to be the expert. I just need to know who the experts are. And Mark is one of them. Good morning, Mark. How are you?
Good morning, Larry. Good morning, Robin.
Good morning.
So how are you doing? Last time we did a rebroadcast because you were not feeling well.
Yes, I unfortunately had a little bit of food poisoning, and it was quite a bad experience for anyone who's had that. You feel pretty rough for about a day and a half.
Oh my gosh! So you got through it okay?
Oh yeah, made it through.
Yeah.
Survived. Didn't think I was going to there for a few hours, but yes, I did. I made it fine.
Do you know, I was listening to the rebroadcast when you weren't here, and I can't remember who brought it up, but somebody brought it up about hair loss, and it must have gone in one ear and out the other when you first said it, because when I heard it on the rebroadcast, that's the first time I heard it, and while there's no pain involved with losing hair, people who've lost their hair who want to get it back always seem to be interested in that topic. So could you talk about it?
Absolutely. And I'm glad that you brought that up again from the rebroadcast. But we've had soft openings, and of course we've been seeing patients for some time now, but now we're going to have a grand opening. And that's going to be September the 23rd.
All right.
And it's going to be from 9 to 1. And Regenetiq we've already been treating and doing services, but is now going to be working with aesthetics as well, meaning utilizing platelet-rich plasma for aesthetic purposes.
Really?
Yes, and one of those purposes, and where it is very effective, is in hair loss. Hair loss can be, a stem cell or a regenerative property can work not only on joints and growing ligaments and tendons and cartilage and things of that nature, but also collagen and regenerative properties for wrinkles in your face, women's décolletage, men with hair, women with hair loss problems can also be treated with PRP and utilizing the body's own regenerative properties to regrow hair, to make wrinkles go away. We also utilize it with microneedling, where we put PRP on your face and microneedle it in.
Wow.
And it is extremely effective. I would advise anyone to either go to our website or look at some of the comparative pictures on the internet of what it does and how effective it is.
And what is the website? Regenetiq.com?
Yep, Regenetiq.com. And that's Regenetiq.
Q. Okay, got it. Okay.
Yep.
So I want to see the before and after pictures. I'm interested in this. What's the science behind it? How does it actually work?
The science, Larry, is the same as how it would work in your knee, for example, or your shoulder. When we utilize PRP, we're utilizing the body's natural regenerative properties, meaning that all of us have in our body right now, today.
Uh-huh.
Okay? if you were to cut yourself with, a paper cut or a knife or anything else, right? You're not going to have an open wound, say, on your hand or your arm for the rest of your life, right?
Right.
Your body is going to send via its vehicle, which is the blood system, it's going to send regenerative properties to that cut and to that trauma in that area, okay?
Right.
And it's going to grow new skin, utilizing its own stem cells and its own regenerative properties. It's going to create new skin, and it takes a couple of weeks or a week or so, and then it's going to seal up that cut on your hand. And it's the same science and the same principle as we are utilizing. By manipulating the blood and spinning it down, we concentrate these regenerative properties in a very, very high concentration, and then we inject it back into the area that we want to have that effect.
And does the body automatically know what to do? In other words, is the same process done on the scalp as on the face? But you're not going to grow hair on your face, right?
No. Yeah, you're not going to grow hair on your face. No, and the properties, and let's say the protocols of what Charlie, who is our nurse practitioner, and he is performing the services. Those protocols is obviously him being a nurse practitioner and Dr. Jordan being a doctor. They have gone and learned those procedures and protocols on exactly how to do it medically to get the result that the patient is looking for. So where as far as that, I mean. Yes, you're not going to grow hair on your face. I mean, he's using a microneedle and different things of that nature, and they'll be using injections and a different process on the scalp. And of course, if they're working on a knee, they're injecting into a joint, which is much deeper. So yes, there's quite a difference in the processes of what they're doing to get the result that a certain patient would want. Yes.
So is the hair loss treatment different for a man than a woman? I mean, we've all probably known women, they don't like us to notice that we notice, but
right.
Society is better with bald men than they are with ladies with thinning hair. But
That's correct.
But I'm sure those ladies know, and I'm sure they wish there was something they could do about it. Is this the answer to that problem?
This is completely the answer to that problem. As a matter of fact, it is more effective and works better for ladies. And the reason why is because of the hormones that men produce, that ladies do not. It is effective and it does work, okay, with men, but the effectiveness is not near as extraordinary or powerful as it is with women. Women with a hair loss or thinning hair, utilizing this procedure is phenomenal. Literally, a brand new head of hair like they were 18 years old.
Wow.
Wow, that is so neat. Hair is important to women.
Yeah.
Sure.
Yeah.
So when you say that and they get a brand new head of hair, is there going to be any chance of them losing that?
Well, okay. So when we get into this realm, it's difficult as a case manager to tell you, no, they're never going to lose their hair. Well, they could go be in a car accident tomorrow. They could. I don't have a crystal ball, okay? But normal, what I tell people, even with Joe and with Patsy and the normal run of the mill, okay, if you're not out there running a marathon every day, your knees are going to hold up. They're going to be fine. And if you're not in a car accident or fall off a bike or slip down some steps, you're fine. I can't predict, what would happen to them, but their normal lives, yes, they're going to have a head of hair, and that's going to work for them, and they're going to be fine. It's not going to go away. It took them however many years to get to that thinning hair, and I don't see it, living to 120. In that case, if they are, then yeah, they may have some of those problems. But on a normal average lifespan, no, they're not going to have any issue with losing hair again.
Mark Shaw is on the phone from the office of Dr. Juan Jordan down in the Villages. And if I could just stress that again, if you're listening to us regularly and you hear us talking to guests all over the world, sometimes they've got good information and you'd love to go see them, but they're just a little bit too far away. In this case, Mark is just 15 miles? No, maybe 20 from here? Maybe
Yeah.
Oh, no.
If
that. Yeah.
Yeah,
If that. It's right around 15 to 20 miles because we're, actually in Lady Lake, which is just this side. We're not in the middle of the Villages.
Gotcha. Okay.
So we're right there right there at the across 441 is the Villages, but we're on the Ocala side. So
south of Bellevue.
Yep.
Yep. The grand opening you said is September 23rd. It's from 9 till 1. And will you be talking, having information?
We will. We're going to have Dr. Jordan there speaking, as well as Charlie and myself, answering questions, having free health surveys, meaning anybody can come and fill out a health survey if you have questions in regards to the pain that you're dealing with. It's totally free to anyone. We're going to have food catered there for probably the first 75 to 100 people. We're going to have Golf Central right there from Ocala. They're going to come out and they're going to do golf swing analysis for us because we know that there are quite a few of those golfers out there that have pain affecting their golf game and their swing. So we're going to have quite a crew out there that people can swing by and enjoy and have a good time and learn a little bit of something potentially about the pain that they deal with on a regular basis.
We had a topic this morning. It was ways to reduce inflammation, and one of them was to lose a few pounds. And I know that you help people with obese issues. I don't know enough about it to be able to connect obesity with inflammation, but I'm guessing you do. Tell me about that a little bit, if you could. I don't mean to throw you a curve there, Mark, but.
Sure. No problem at all. We very often, many of our patients with Dr. Jordan and that he has referred into our weight loss program are, meaning when I say either obese or overweight, this is what our weight loss program is for. It's not for the patients who want to lose 5 pounds so that they, look good for bikini season. It's for, we've had diabetic patients where this is a real life or death issue, or patients who need to go have a surgery, but surgeons won't take them into surgery because they're overweight. And it's too dangerous to anesthetize or put them under and to have the surgery done. Yes, inflammation and dysfunction or degeneration on your joints is very much affected by the weight that you're carrying around. Just simply look at the tires on your car, Larry. If you went and put an elephant on top of your car and drove around, do you think that it would be
good point?
More? It would be more adverse to your tires or your shocks or your struts or anything else that you have on the wheels and the tires. It's going to put a lot of stress on those parts, and it's going to cause inflammation, degeneration of the joint, and over time it's going to break and wear things out, like knees, ankles, hips, low back in men, and that's what we work with on a full scale, meaning from let's lose the weight, okay, which we have a medical weight loss program that in women is usually 35 to 40 pounds of nothing but fat. And in men, unlike the hair, the weight loss does work better for them. They lose about 45 to 50 pounds.
Let me ask you if you could explain the snowball effect in reverse. If you were to look at anybody who's gone downhill regarding their health, sometimes they get obese and then they stop exercising as much, and that kind of adds to the problem. And one thing leads to the next in the negative direction. Sure. Does the same thing happen in reverse? If you, for example, as a clinic, help somebody lose weight, do you then see them kind of moving around more? So they're exercising more, And does that work with the brain as well? Does our mental, the fogginess that we might get into, does that start to go away as we become more active?
Absolutely. Absolutely. It's a scientific fact, when you're able to exercise and you're able to move around, it releases endorphins in your body, and you become happier and, more euphoric, and your tone, your general happiness is increased when those things happen. So absolutely. That it is the exact opposite, and it does reverse time, so to speak, than it does, having to sit around and do nothing.
Yeah.
And that is what we try to get people back to in their lives, meaning our weight loss program is designed exactly for that. You do not exercise. 80% of weight loss or gain is what you eat and what you put in your mouth. So that's what ours works from, and medical injections that we use. We tip the scale dramatically in the patient's favor, and we help them get to a point where, it's a lifestyle change for them, where then they can manage their weight and don't gain the 35, 40 pounds back, and manage their weight for the rest of their life, doing normal things, going to the grocery store and eating real food. Okay, what can't be sustained is, hey, I'm going to eat this bar or this shake, or I'm going to do this no carb for you can't sustain that. That's not sustainable for the rest of your life. And when you starve the body of one thing and then bring it back, you're just going to gain all of that weight back plus 5-10 pounds, whatever.
Do you help high school athletes? Because sometimes they're in the best shape ever, but then they still have issues.
Oh yeah. Some have issues. Yes, we help high school athletes, but we also help high school people, any age range, not just elderly people or people in their 40s, like myself, have weight gain. In our school systems and in our kids today, there are kids who struggle with obesity and weight gain, and we absolutely help and work with them as well. And we work with high school athletes in regards to injuries, which quite often athletes are injured, even in high school, whether it's football, baseball, and basketball. So yes, PRP works very effectively on them as well.
The program you're listening to is called Regenetiq, and it is the representation of the medical offices of Dr. Juan C. Jordan down in the Villages. Mark Shaw is the case manager for Dr. Jordan, and he educates us about what is available down there, whether it's geriatric care. I guess that's an umbrella statement, and that would include issues like obesity, maybe wrinkles that you're a little bit you wish you could get rid of. It sounds like you can. There's a whole aesthetic application to the platelet-rich plasma, which we learned about in the beginning from the injection into the knees. And if you have knee, or what do you actually call it, cartilage or soft tissue? What do you actually call the problem area?
Well, the problem area is usually it's degeneration of the joint. Okay. Whether that's, if you think of ligaments as rope, you think of cartilage as a shock absorber on the bottom of your tennis shoe, arthritis, okay? But if you think of those in that way, let's say a ligament was a complete rupture. Well, that's not something for PRP. I mean, that's the rope is completely cut in half, all right? That is a surgeon's job, to go in and to sew that and to put that back together. However, little slight tears, you ever seen an old piece of rope that has a bunch of frayed edges and pieces of the rope hanging out and everything else, right?
Right.
That is a job for PRP. We come back in, and like glue, we take and we put over that entire rope, and we glue all those pieces back in together. And now it's one piece of rope again without all the pieces frayed and hanging out, which can cause pain and discomfort. The same with cartilage as a shock absorber. Many people have heard, oh, well, my knee's bone on bone. Okay. Unless you've actually had surgery and had all of the cartilage removed, it's not literally bone on bone. That cartilage may be paper thin in there, okay? But it's still there. And when we inject utilizing PRP, it is increasing that shock absorber, and it's basically adding more layers to the sole of your shoe as a shock absorber. So now it's adding cartilage there and increasing the disc space and the space in between that knee so that nerve endings are not touching anymore, which is very painful.
Gosh.
I know you've covered this before, but I wanted you to mention it again for the new listeners. When somebody comes into the office, you've told us the first visit is free, correct?
Yes. Your first consultation with us is always free, and the reason being is because we don't accept patients that it is not the right procedure for, and we help you determine that. Meaning, if we can't help you, you need to see a surgeon or you need to see some other form of doctor. We will do the work and we will refer you to the correct doctor. And so we do not charge anything for our first consultation and our first visit, where we're assessing whether PRP can be utilized for whatever your problems are.
And does the patient, during that first visit, do they let you know all of the insurance that they have? And talk a little bit about that.
Yes, they let us know all the insurance and everything that they have. You do not have to be a patient of Dr. Jordan's, meaning he does not have to be your primary care in order for you to come see us. You can keep your primary care doctor and come discuss PRP or knee or pain problems with us, and that's totally fine. We have the Foundation for Wellness Professionals, meaning whatever insurance does not cover in our office, it is not, the patient is not going to have to pay upfront, let's say $500 or $600 or $1,000 or whatever procedures that they receive. Anything that's a cash payment in our office can be utilized to the Foundation for Wellness Professionals, where they will finance it interest-free with no credit checks to the patient at whatever payments they can afford on a weekly, monthly basis. If you can afford, $15 a week, that's fine. The foundation is the 501c3, and they're there just for that. You
Wow.
have access to that money, and they will let you get whatever procedure that you need.
Wow, that is amazing, really. Hopefully, if you've been listening to the whole show, you kind of heard a thumbnail sketch of everything that they do down at Dr. Juan Jordan's office. Mark Shaw is who you've been listening to. Mark, before we say goodbye, give us some contact information, phone number, address, etc.
Absolutely. You can contact us at 352-633-0473. That is going to be our main line. You're going to talk with Elizabeth. She is fantastic at getting you scheduled into our schedule for a free consultation. Just say, I've heard on the radio and I'd like to discuss my knee or a free consultation with Mark, Charlie, or Dr. Jordan. We're happy to do that, and she'll get you right in the schedule. Regenetiq.com. You can go to our website. You can see all of the referrals and the stories and different people who've been treated, and that's Regenetiq. Regenetiq.com. So that's our contact. Please take advantage of it. Give us a call.
Absolutely. And for the listeners, please share the video with somebody you know can benefit from the services. And I can't stress it enough. Dr. Jordan is down in the villages. He's not across the country somewhere.
Yeah.
Mark, always good to hear from you. I'm glad you dealt with that food poisoning and are okay now. Yeah.
Thanks so much, Larry and Robin. I appreciate you both having me.
All right. Thank you. We will be right back. Here is your 30-second news brief. The Marion County School Board has closed all public schools for tomorrow, September 8th, and Monday, September 11th, due to Hurricane Irma. Some schools will be used as shelters. The hurricane is expected to hug the Atlantic coast with winds and rain affecting the entire state. Ocala will begin to feel the outermost bands on Sunday and the most intense weather early Monday morning and into Monday afternoon. And that is your news brief from your emergency alert station, WOCA The Source.
News happens fast. And when it happens here. The leader in talk radio.
96.3 FM.
Fox News Radio. I'm Chris Foster. There's a lot of